Om Shanti to everyone. Welcome to the pranayam class. Hi Jane, how are you, dear?
Very well, thank you.
Okay, let's start the session with keep your back neck straight, come into the comfortable position. Any meditative posture, any sitting posture you can choose. Relax your body completely. Relax your palm on the knee, chin parallel to the ground, and gently close your eyes. Now, bring the awareness towards your natural flow of the breath, how the breath going in and coming out. Now, bring your awareness towards your inhalation and exhalation. Take a very deep, prolonged, slow breath. Deep, prolonged, slow exhalation. Keep practicing for a few more seconds, inhalation and exhalation. Now, prepare yourself for the 3-time chanting along with Shanti. Take a deep, prolonged breath for the Om. Shanti, Shanti, Shanti. Feel the vibration and sensation. Now join your both palms together in front of the chest. Rub your palm. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. Now, in previous session, we discussed about it, the normal breathing. And as I talked already, normal breathing is a pre-practice of the um, many others breathing, like abdominal breathing, chest breathing, or all kind of pre-practice of the pranayam, right? So normal breathing is very much important before introducing the abdominal breathing, which is the today topic. Today we're gonna learn about the abdominal breathing, that is your belly breathing. Another name for the abdominal breathing, that is a belly breathing call. So importance of the normal breathing, I already discussed about it, but understand this, you cannot directly jump into the abdominal breathing. First, you have to take care of that your student should be know how to breathe in and breathe out, and they should do with the nostril, right? They have to inhale and exhale through the nostril. So this kind of breathing, when you're introducing the abdominal breathing, before that, they have to aware about the inhalation and exhalation and how they have to put effort in inhalation and exhalation. So Purak and Rechak should be, Purak, the deep, prolonged, slow inhalation, Rechak, deep, prolonged, slow exhalation should be, correct. Now, abdominal breathing. So today you can write it down, abdominal breathing, today topic. Now, abdominal breathing is basically the belly breathing. We gonna do the breathing from belly, but understand actually your belly doesn't get the air. Okay, the air go into your lungs only. But because of the diaphragm moving up and down, that's why you feel the expansion in the belly, and that's how you feel squeeze like belly go inside. That's why you are feeling because of the diaphragm moving up and down. So in abdominal breathing, even when you do the normal breathing also, belly also move, your abdominal part also move. But understand in this abdominal breathing, what we're gonna do, we have to put lots of effort in inhalation and uh, popping out our belly like forcefully. It's like expansion of the belly in fullest form. And then we squeezing in the like, you have to squeeze, contract your belly as much as you can do. That's what we're gonna do. So for that, you require empty stomach, but it's okay if you're not. Um, that's totally fine, because in order to learn the technique, it's okay. But if you're practicing daily, so in that case, morning time is the ideal time for practicing the abdominal breathing. And this abdominal breathing, again, once you practice the abdominal breathing, you are preparing yourself for the chest breathing, thoracic breathing, which we're gonna learn tomorrow in tomorrow's session. So this abdominal breathing, when you are practicing it, you are giving the massage to all the major organs of your body. As you know, in your abdominal cavity, this is the hollow space, right? So in your abdominal cavity, you have pancreas, you have kidneys, you have, the small intestine, large intestine, major, your uterus, your urethra, your bladder, everything is located in your upper part of the abdominal and lower part of the abdominal cavity. So major organs, your liver, everything is located there. You are giving the more blood circulation that area. So it means the problem related to these areas. I know if many students ask how we can remember that this kind of breathing is suitable for that kind of problem. So remember that when you are doing the breathing, so trick is for remembering when you do the breathing, which part you are activating more. So when that part is activated more, so hence the problem related to that area would be sorted out, right? So that's how you connect it. So if you have problem related to this area, your abdominal area, like your pancreas, some people have diabetic, some people have liver issue, liver psoriasis or something like that, or indigestion problem or constipation, any problem, okay, any problem related to the your abdominal cavity, or infection, PCOD, any kind of urine infection, even somebody having it, they can practice this abdominal breathing. It's gonna help them out. It's gonna heal them very quickly. Along with the medication, yes, they have to go with the medication. But here you're increasing the blood circulation. Once blood circulation is increased, it means these organs get the more oxygen, the organ cells get the more oxygen, and then it's gonna heal very quickly. So are you understanding the connection between, right? Now, this abdominal breathing, like your belly is more like a balloon. How you fill the air into the balloon, same like you're filling the air into your chest, and diaphragm move towards your belly and belly pop out. It's like a balloon kind of thing. Sometime at I remember in my childhood, I used to play like belly pop out and belly go in, like making the balloon, playing with our belly. So same thing we're gonna do with it, but with lots of awareness. Okay, with lots of effort you are putting into it, with conscious mind you are doing it, because the function of respiratory system is work like air goes into your lungs, and then later on it's reached towards by the heart. With the help of the heart, it's go circulated in rest of the area. But what happened when you push something and you consciously aware of that part, this procedure become very fast and quickly. You those organs get the oxygen very fast level when your mind is connected with the movement of your body. So whenever you do any breathing practice, you have to consciously focus on that. So you get more benefited, more advanced level of, the higher, you're going to increase the, you can, when mind is connected with the any action of your body, either it's inhalation or exhalation, this is also the activity you are doing it. So it for time you will get the benefit. You're going to increase that, benefit in that manner. So very much important that fully you are aware of your breathing part, inhalation and exhalation. I'll give you the instruction. Precaution, no, there is no precaution dear. All the people, all the problems in even mental disorder, psychosomatic disorder, I keep telling this is the safe practice. Normal breathing is also safe practice, and abdominal breathing is also the safe practice. Even people who get anxiety attack now, if they do this kind of abdominal breathing lead you towards the deeper level of the breathing. And when you get the anxiety attack, have you seen your diaphragmatic muscles are weak? And that's how, because of that, they have the shorter breath. They have the shortness of the breath. They cannot breathe properly when they get anxiety attack. So in that time, if they do the abdominal breathing, they can, go for the deeper level of the breathing, and they can reduce the anxiety attack, anxiety disorder. So one of the, best, you can use as a best medication without any pills and anything. Abdominal breathing not even, helpful in curing the anxiety attack, but also the depression and insomnia. If you cannot fall into the sleep in supine position, again you can practice this abdominal breathing, and you can see you get the better sleep. So benefit is so tremendous of this breathing, so tremendous. Even if you get the any infection, virus infection, like I got the COVID, my mom get the COVID, in that situation we are doing the more abdominal breathing, so our oxygen saturation would not be go down, and we don't require the oxygen cylinder. So I even experimented on that thing in this pandemic situation, and I figured out the benefit is so tremendous of this abdominal breathing, and it's very safe. um, and all the body, organs gonna activate it, major body organs gonna activate it by just simple breathing practice, that is the abdominal breathing practice. So what kind of posture you require to practice? Best you can use Vajrasana. Vajrasana is very helpful for doing the abdominal breathing. Vajra, VAJAR, Vajra, VAJARASANA, Vajra Asan. In English, we call thunderbolt pose. You can ask your asana teacher. he will explain you. Thunderbolt pose, how to go into that pose, he gonna explain you. So you can do this practice in Vajrasana. Vajrasana is very best asana for allowing your belly to give the space for expansion and keeping your back neck aligned also. Along with the Vajrasana, Swastikasana, Padmasana, in previous video also I talked about it. These are the best posture. So these two posture again you can practice. Vajrasana is one of my favorite asana. I most of the time do this practice in the Vajrasana. But if you have knee injury, any kind of problem, you can also avoid the Vajrasana and the Padmasana because it gives you major pressure on the knee issue. So especially people who are having arthritis, osteoporosis, and any bone related issue, any injury in achilles tendon issues, ligament and tendons are weak, in that time they should avoid these kind of posture, these asana. So simple sukhasana or even sitting on the stool with the keeping back neck straight, they can practice. So examine your students before introducing any asana also for the breathing practice. And this breathing practice is safe. They can still practice, but choose the asana according to their condition. Okay. Now, any doubts here, any difficulty to ask about it related to this abdominal breathing? If not, we're gonna start with the practice of abdominal breathing.
Ma'am, uh, while sitting in Vajrasana or Sastikasana or Padmasana, any asana, do we need to place any mudras or just we can keep our palm at the knee?
Mudras is to, again, play very crucial role. But for applying the mudras, you have to first correct your energy level. So right now we are learning, right? Mudras cannot be introduced on initial level because first you have to, mudras function. I'm gonna introduce you mudras, but first you're gonna correct your energy level, correct your breathing pattern, and then you're gonna introduce the mudras, because where you're gonna lock your energy, right? You're going to lock the energy when you're applying the gesture with the hasta mudra. Basically, hasta mudra is a hand gesture, you are applying it. So there's a types of the mudras also, but understand when you have to introduce the mudras to your student. You cannot just introduce like that because it's become fashion. No, everybody is introducing the mudra. First, understand initial level, they have to correct their breathing pattern. So that's why we practice the normal breathing. Once they have get into the perfection, they are aware of their normal breathing, then abdominal breathing, then after abdominal breathing, thoracic breathing, we come to that. And then when they do the breathing part, then pranayam, along with the pranayam, we're going to implement the mudras. But yes, when you are trained in the asana practice, then anytime, whenever you're even sitting in the meditation, you are not doing the breathing part, you can apply the mudra. Okay. But first, before that, you have to work on your energy level. You have to correct your organs first, your alignment first, and then we're going to introduce the mudras. Am I clear? Okay.
Yes, ma'am.
Now, uh, the ideal time of practicing abdominal breathing, anytime you can practice, but make sure empty stomach you're gonna practice. Especially people who are having indigestion problem, they can practice even before the meal also. Whenever they're going, the people who are having bloating issue, they feel the pain after eating the food. So before having the meal, they can do practice the 10 to 15 minutes, they can practice the abdominal breathing and they can see the results immediately. Okay. But best time, as I keep saying, early morning is the best time and evening time is the ideal for the pranayam and breathing practice also. So let's start practicing the abdominal breathing. Choose your posture, any posture, sukhasana, vajrasana, Siddhasana or Padmasana or Ardha Padmasana or just normal sitting posture, whatever you feel comfortable, go into that posture. Keeping your back neck straight, align and gently close your eyes and pay attention towards my instruction. Go into your pose. Observe how's your neck, how's your back, how's your spine, your legs. Where palm is resting, shoulder completely depressed, relaxed, chin parallel to the ground. Now bring your awareness towards your natural breath. Observe how the air go inside and coming out. Now start practicing the normal breathing first. That is a preparation for the abdominal breathing. Take a deep, prolonged inhalation and exhale through the nostril deeply. Inhale and exhale. Inhale and exhale. Make sure Purak and Rechak should be long, deep, slow. Be aware of each and every breath, how the breath going in and coming out. Breath is deeper, longer. Allow your mind to connect with the each and every breath. Make sure without any acknowledgement, not a single breath go in and coming out. Consciously, you are doing the normal breathing. Now, exhale completely through your both nostrils. As you inhale, air go into your nostril and passing through your lungs, diaphragm move towards your belly. Expand your belly completely. Try to fill, consider your belly like a balloon. Completely as much as you can fill the air into the balloon, same way you are filling the air, expanding your belly. As you exhale, very slowly, squeeze your belly in. Exhale completely. Inhale. Inhalation should be done with the movement of your belly slowly popping out, like how you're pumping the air into the balloon. Very slowly, and balloon gonna expand. Same way, your belly gonna expand. As you exhale, how balloon release the air, not fast, but very slowly. You have to take out the air from your belly. Belly squeeze, contracted, diaphragm move towards the lungs. Lungs contracted, rib cage, and exhale completely. With awareness, with consciousness, practice. Make sure your mind is fully connected with the each and every breath. Feel the movement of your belly and how every organs are get the blood circulation and massage by the movement of the belly. Completely focus on your belly movement, your abdominal area. Awareness should be around your lower and upper abdominal area. How they are moving with each and every breath. Inhalation and exhalation. The deeper level of the inhalation and exhalation going on here. If you lose your mind, lost your mind into the thoughts, come back to your abdominal breathing. Do not just feel guilty about it. Just come back to your abdominal breathing. Learn the technique with conscious mind, with awareness, and observe how the breath going on in and out, how the Pura can reach moving your diaphragm up and down. Be conscious of each and every part of your body, which moving along with your inhalation and exhalation. But body remains still. Filling the air into your lungs, which expand your belly slowly. And as you squeeze your belly, air comes out. You have to observe this whole journey of the breath also. With each every inhalation, observe how the breath reaches to your lungs, expansion happen, diaphragm move towards your belly, belly pop out completely. As you squeeze, belly contracted, diaphragm moves towards your lungs. Contraction happen into your lungs. And as you exhale completely. Deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation. Each and every inhalation is play very important role. Be attentively you are practicing. Anytime if you get tired, you can again come back to the normal breathing. Relax there and again start the abdominal breathing. Now very slowly bring your awareness towards your natural breath. Take your own time. Take your own time to come out and bring your awareness towards the natural breath. Observe how you are inhaling and exhaling. This abdominal breathing heal you not physically but mentally also. If you observe, your mind is more focused, more concentrated while practicing this abdominal breathing. Now very slowly, come back to your body, come back to your position, your posture, your asana. Observe your alignment. Observe how's your neck, your back, your shoulder, your palm. Bring your awareness towards your body, your posture, your asana. Now, prepare yourself for the 3-time chanting along with Shanti. Take a deep, prolonged inhalation. Exhale. Inhale. Exhale. Inhale. Exhale. Now inhale for the Om. Shanti, Shanti, Shanti. Feel the warmness. Feel the sensation, vibration of chanting. Join your both palms together. Rub your palm. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. Now, any queries, any difficulty related to the technique and related to the benefit and precaution, anything which you don't understand. So no question. That's wonderful. All things are clear to everyone. Lovely. Uh, Now this practice you can do in the supine position also. So this is a homework for you guys. You're gonna lie down on the supine position and experience that how your belly gonna move up and down. Because when you do in the supine position, you can feel more the expansion of the belly, right? But only to just understand this technique. So you're gonna make the notes accordingly, which you technique find more comfortable for you, supine position or this meditative posture, sitting position. So this you're gonna note it down, and end of the week you're gonna submit the assignment related to that. Don't worry, I'll tell you where you have to submit it. But try daily you have to do the certain task and then make your own notes and then it's gonna help you out also to understand which technique, which sitting posture is more appropriate for the what kind of breathing. And as I keep telling you, supine position again you can practice, but understand more benefit when you do, you will get when you do in the sitting posture, right? Because there's a science behind of it. But yes, go with your experiment, see, get your own experience, how you feel. Supine posture is much better than the sitting posture, or what you feel about it. Okay, so this is the homework for you guys, and you have to Saturday would be off for you guys. Saturday and Sunday is off for my class. Rest of the classes keep going on, and I'll give you the assignment on the Friday day. Okay. So enjoy your day and keep learning, keep doing and practice these things. These are the wonderful things, and we all are blessed that we come into the contact with the yoga, and daily we are, you have to motivate yourself to practice these things, because I know pranayama and meditation is very boring thing. Nobody's are showing the interest towards it. It's not having wow or wonderful experience. But believe me, this is the most appropriate way to get your health and healthy, and through that you can become the healthy being. Om Shanti, Namaskaram. Bless you guys. Have a wonderful day ahead. Meet you at meditation class. Bye-bye. Take care.
Thank you, ma'am. Namaskar.
Namaskaram, dear.